the federal government says it is strengthening routine immunization as one of the means of safeguarding the lives of Nigerians, especially from infection and transmission of the dreaded COVID-19 disease. At the launch of Scales 3.0 strategy to accelerate COVID-19 vaccination in the country, the Federal Ministry of Health and the Presidential Steering Committee on COVID-19 said the launch will ensure the vaccination of at least 70% of the eligible population by the end of the year 2022 through the National Primary Healthcare Development Agency and its partners. Here's that report.
Scales 3.0 is an acronym for service delivery, communication, accountability, logistics, electronic management of immunization data, and supportive supervision. The launch of the strategy for the ongoing COVID-19 vaccination is premised on speeding up the level of uptake of COVID-19 vaccine to achieve and maintain herd immunity.
Most of the world that has been affected adversely has gone ahead and vaccinated almost the entire population. We've heard it, Africa has been lagging behind.
Scales 3 is important in that it allows us to look at immunization holistically. It allows us to bring COVID-19 into the routine immunization and the integration of immunization as a way forward to protect the health of this nation.
So we are very much aligned with the work of our sister agency, the NPHCDA, with all the efforts to deliver vaccines, COVID vaccines, as part of the national response to the COVID-19 pandemic.
Delivering the keynote address, Secretary to the Government of the Federation and Chairman of the Presidential Steering Committee on COVID-19, Bas Mustafa, noted that the success recorded with the Scales 2.0 necessitated the acceleration of integrated COVID-19 vaccination and primary healthcare services across the country.
Nigeria has continued to experience changes in the factors that influence demand and uptake of COVID-19 vaccines. These changing situations are not uniform across the country. They vary from state to state and therefore require continuous review of our strategies for promoting demand and ensuring vaccines access and accountability.
In his remarks, the Executive Director of the National Primary Healthcare Development Agency, Faisal Shuaib, noted that strategic review showed that there has been an increased low COVID-19 risk perception which needs to be overcome while eliminating state-specific bottlenecks to achieve improved vaccine uptake.
It is for these reasons, among others, that the Presidential Steering Committee on COVID-19 and the Federal Ministry of Health through the National Primary Healthcare Development Agency has come up with the Scales 3.0 strategy, which we are here to officially flag off.
Minister of Health Ehanire Osage maintained that it has become imperative for the government to launch Scales 3.0 strategy, which entails the acceleration of COVID-19 vaccination to achieve more in confronting the virus.
This very important project is a major step in our common resolve to confront the COVID-19 virus and at the same time scale up routine immunization so that one is not being done at the expense of the other.
I have the singular honor and privilege to officially flag off the launch of the Scales 3.0 to the benefit of the people of Nigeria.
The launch of Scales 3.0 also birthed the introduction of the second dose of the booster vaccines, with calls on stakeholders to mobilize community members of eligible population to get vaccinated. Aisha Salihu, Trust TV News, Abuja.